Hello, my name is Cass. I'm one of the clinical teachers here at Ballarat Health Services, and I'm going to talk to you about the National Inpatient Medication Chart. As you can see, it's got writing on all four sides, the inside, that side, and when you turn it round, on the back it's got areas for prescribing as well. So we'll just start with the identification. This box, it needs to have either a medication label, also known as a BRADMAR, or it can be handwritten. Essential criteria needs to be the patient's name, the UR number, their date of birth, their gender, and lastly, the first prescriber needs to sign after they've done their patient identification. The next three boxes are highlighted in red as they are high risk medications, and it just alerts you to double check. This one is about the allergies or adverse reactions that the patient has had. That too needs to be signed by the first prescriber. Moving down the chart, you've got your variable dose medications. So these are for medications that rely on tests, or such as gentamicin, or they're a scaled medication such as steroids. So that will change day to day the doses. Further down is your venous thromboembolism risk assessment and prescription, along with your mechanical prophylaxis. So things like your compression stockings need to be charted there and signed for. The last of your high risk medications is your warfarin. The essential criteria is your INR results. Need to be charted along with the dose. And every day it may be a different dose. So that needs to be looked at quite carefully, along with which brand of warfarin has been charted and what you're about to administer. Moving on from that is your regular medications, and this is a 7-day chart, and the columns are white and grey, just to make it a bit easier when you're signing for medications. When you're looking at a legible order, it needs to be a generic name of the medication. It needs to have the route, the correct dose, how frequent the doctors are wanting it, the indication for the medication, as well as their signature, and preferably a contact number. The doctors can have a look at the administration times here. So there's a box that gives them the TDS or QID preferred times they would like, and they need to actually chart that rather than the nurses writing in the times. If it is not legible, if you can't understand or read the dose or what medication they're prescribing, you cannot give this medication. You need to contact the doctor and get it rewritten. And this is for the safety of the patient. Moving on to the next section of the chart is our once only or nurse initiated medications. So the doctors will often write medications here if they only want one dose given of a medication, or as a registered nurse, there's certain medications that we are allowed to initiate. There's also your telephone orders, which need to be signed by a medical officer within the 24-hour period, and needs to be co-signed by your second registered nurse. So moving down the chart, you'll see that there is a red box. This is just to highlight medications that the patients were taking prior to their admission in hospital. only because some of the medications that are prescribed here may not be the same medications or the same doses that they were taking prior to their admission. So medications can change throughout a patient's journey through the hospital, and an important aspect of medication charts is actually medication reconciliation. So this is done by a doctor that is familiar with reconciling medications, and it helps the pharmacist work out on discharge what the patient should be going home with and what their previous medications were. On the last page of the medication chart is the PRN medication, so the as required or as needed medications. This is often things like analgesia or antiemetics that the patient may need when they feel sick or have further pain that we need to address. The same principles apply in terms of a legible order, generic name, the correct route, time and dose, and a signature from the doctor. As with all your medication administration, you need to ensure that you are doing your 5 rights of medication administration. So the correct medication, the correct route, the correct dose, the correct frequency, and the correct patient, as well as looking at their allergies before you administer medications. As a practice point, I would be looking at all sides of the medication chart before you administer something, a medication that is on your regular dosage, just to ensure that it hasn't been given as a once only an hour ago or even as a PRN medication, so that you decrease the risk of double dosing the patient or overdosing the patient or having drug interactions. So they're the main criteria for the National Inpatient Medication Chart. Thank you.